after a 24-inch water main at 141st and Alder Streets broke. The mayor tells me that it was a weak joint that actually gave way around 6 a.m. Sunday. A cap then blew off and left the entire city of East Chicago without water.
Well, one Sunday morning, I received a phone call from a station engineer named Vito. He called me and said, "Cuba, you gotta get out here." I said, "What's wrong?" He says, "I think we're losing water."
In the meantime, we called Bill Lipkin, Bill Phelps, Bill Boyles, Paul Christina, and everybody got here within an hour, and then it all just took off. We didn't have any water in this building whatsoever.
I called Chief Garza again. Well, he said he's going to get some tankers out here. Well, he did. He got 3,000-gallon tankers out here.
I talked to our maintenance guy, Bill Lipke, and I asked him how much water they needed. So they said about at least 400 gallons of water. So within the next day, we had at least 400 gallons of water here.
When we first got word, we thought that it was going to be for a very short period of time, and it ended up to be much more extensive than we had originally anticipated. So not only did we get water for consumption, other safety mechanisms that we had was we wanted to make sure we had plenty of water so that scrubs could still continue for hand washing for patients who had C. diff. We actually looked through all available services and went through all major departments and really determined that we could continue to provide safe, quality care with the exception of dialysis, and those were our only patients that we had to transfer.
When we initially found out about the lack of water in East Chicago, we sat down as a team to go over our workflow and what things that we do every day that we rely on water for. We kept the patients at the center of these discussions. We had to work through how we were going to continue to provide safe, quality care to our patients.
Timing is everything, so they say, because about a month prior to this water main breaking, I had switched to a new microfiber cleaning system, which enabled my staff to still keep the environment safe, but using a lot less water.
One day, Bill Lipke, my director, came in and says, "Cuba, do we have a contingency plan for city loss of water?" And I says, "No." He says, "Well, get on it, see what you can do about it." Okay, so then we call Chief Garza up, and Chief Garza says, we needed 5-inch doors to put on our tank. We put it on, and 3 weeks later, we had loss of water. Who would imagine this would happen so soon?
Maintenance had told me that our water, the freezers and the coolers will be out of service because of they're all water cooled. And the city has been pumping water into the hospital because of the steam and for our heaters. And so I called one of my vendors and I asked them if they can deliver a freezer truck over here.
So because of the hard work of the sterile processing department across the facilities, we were able to maintain services to our patients during the water outage in East Chicago.
Joey Seabrook, the infection control nurse, was right behind our staff, culturing and swabbing items like beds and doorknobs and things like that, multi-touch surfaces. The cultures were coming back negative. So that meant that my staff was still keeping the environment safe for all of our patients and their caregivers and their families, even though we had no running water here at St. Catherine's.
The majority of us have been here a lot of years and we're older hands at it, so we just did what needed to be done, and you realize that once you're out of water, your whole world changes.
The most interesting part with this whole disaster was there was no, we didn't lose a beat. We served food like it was on a daily basis.
We had no patients were rescheduled during this time. We certainly let the patients know when they came in. There may be some inconveniences when they were here, but none of them chose to reschedule their surgeries.
So we just jumped in, volunteered our services to the lab. I brought in an extra person for a shuttle driver, just to shuttle specimens back and forth. We went and bought up, I think, all the ice that we could find in East Chicago. We had people that were coming in our drive-through and getting out with their rolls of toilet tissue and getting out to use the facilities. And we brought everything together and looked at it as, we're here at St. Catherine's with our St. Catherine's family, so we just kind of extended it out to our community, and our East Chicago family came in to use our porta potties, and And it turned out okay.
They were asking a few times if they should go on bypass, and of course, we don't want to hurt the community, so we wanted to stay open as long as we could and provide safe quality care. So we did until the very, very end, and then we didn't know for sure how much longer it was going to be. So yes, maybe at the last minute we should go on bypass. And the minute that we said we should go on bypass, then they fixed the water supply again.
The staff's response to these challenges, though, was truly remarkable. Their adaptability, as well as their continued focus on patient care, was top-notch. I want to say thank you and congratulate the entire team for doing such a tremendous job.
I was so impressed by the quality and the commitment of our staff and our physicians. It was really a big pain in the neck. But they did not bat an eye. They were very resilient. They had a very positive attitude, and they just said, there's nothing we can do about it. Let's make the best of it, and they certainly did.
It's everybody in the hospital just pulled together, and it's teamwork. And that's what the community is all about.
I want to thank Chris Clemens, Frank Santana, Marvin Massey, Augusta Estabito, and everyone that was involved to make our job a little easier.
And so I must truly thank my staff, and I also want to thank nursing for the cooperation that we had during this crisis. I thought we handled it very well, and I thought we had some great patient outcomes.
It's like I can't believe how this group comes together all in one. And Lipke goes, you know what, Kevin, this group is known as a group that comes together in a time of need and really gets it done.
When we talk about it now, we think it was like no big deal, but it was a huge deal what we did, and we couldn't have done it alone. It was because we worked as a team and as a system that we were able to do this.
Dorothy told me we had trouble in the can. I headed for the headers with my plunger in my hand. So I better not go too much work.